The brain controls many things. It controls respiration, it controls the function of the heart. It also has some endocrine control. So for lay people, we really need to be aware of these studies and even amplify the results. It led to recommendations that are very key in improving brain outcome.
Welcome to the first episode of our author interview series at the East African Journal of Neurological Sciences podcast, brought to you in partnership with Daktari Online. Today, we'll have the privilege of interviewing an author of a paper that goes back from our first ever issue that we ever published, and personally really excited for the conversation we'll have. And the objective of this is just to make this work that we've published look a bit easier for you to understand, and I hope you enjoy the episode, and please remember to subscribe. So let's get into it. So today I am joined by the author. I'll let him introduce himself, and he authored a paper from our first ever volume 1 issue 2 on the association between potassium in serum. Association between serum potassium ion abnormalities and clinico-radiologic parameters in severe traumatic brain injury. So, welcome.
Thank you, Felix. So my name is Mwachaka. I'm a neurosurgeon working at the University of Nairobi and also doing clinical work at the Kenyatta National Hospital. And I was very privileged to be one of the authors of a paper that was published in the inaugural issue of the journal. Thank you.
Thank you. And let's talk a bit more about your paper, a bit of a background, maybe for anyone, because the title may scare a few people who are not maybe very conversant with the topic. Maybe you can break everything down for us. Number one, what is this severe traumatic brain injury that we've had mentioned in the title? And what is serum potassium? And then what are clinical/radiological parameters?
Okay. So this is work that I conducted when I was doing residency in neurosurgery, and this paper is one of the papers that we managed to publish from the research work that we did. And the research work was titled Serum Electrolyte Abnormalities in Traumatic Brain Injured Patients, the severely traumatic brain injury patients. So what is traumatic brain injury? So this is any injury that occurs to the brain as a result of trauma. And in our country, we are having an epidemic of trauma, and head injury or brain injury is one of those issues that we commonly encounter. We tend to get patients who come in who are very sick, and there's a way we grade traumatic brain injury from mild, moderate to severe. And there are grading parameters. One of them is the Glasgow Coma Score. And this score has parameters ranging from 3 to 15. So anyone that has a Glasgow Coma Score, or what we call GCS, between 3 and 8, that one is classified as severe traumatic brain injury. So there are issues that now come with that injury to the brain. We tend to have electrolyte issues that may arise, and we actually conducted this study because we saw that our patients, despite some of them, despite like having intervention, very good intervention in terms of surgery, they were not having very good outcomes. And one of the things that we thought of was maybe we could be having things like electrolytes. Electrolytes are basically ions within our body, and they could include things like sodium, potassium, calcium, magnesium. So all these electrolytes are very important for functioning of the nervous system. And that is what we sought out to study. And this paper was specifically on potassium, because potassium is one of the key ions or electrolytes that are very important for conduction of nerve signals. And it is required to be in the right amounts. Otherwise, you'll have either increased conduction or very slowed conduction. And so we sought out to find out from our cohort of patients. We looked at patients that were admitted at the Kenyatta National Hospital, which is our referral hospital, a national referral hospital, and specifically those that had severe head injury. And we were looking at basically how is this ion in terms of when they present and what happens later on in the course of the admission, and whether that has an effect on outcome. Yes. Okay. So that is in summary what the study was all about.
Okay, that's a very comprehensive background. And so maybe just in 2 sentences, maybe you could let people know the why you saw the study as very necessary in our country. As you mentioned, we do have an epidemic of traumatic brain injury, and maybe you could re-emphasize that for our listeners.
Yes. Yeah. The reason why we carried out this study was based on observation of our patients in the unit. We saw that patients would come with a lesion or with a problem. When we do a scan, we find maybe there's bleeding within the brain. We go do surgery, remove all the clot that was there. But later on, some will do very well, same lesion, others will do poorly. So the question was, what are the other things that could be happening in these patients? And some of the things that we thought could be causing bad outcomes were the electrolytes, that they were not being picked up early and not being managed early, leading to now poor outcomes.
Okay. Okay. And so how did you conduct the study? How did you design the study? How did you implement? How did you categorize your patients? And how further did you extract the data and analyze it?
Yeah, so this was a prospective cohort study that was approved by the Kenyatta National Hospital, University of Nairobi Ethics and Review Board. And we recruited patients after getting consent from their next of kin, because these were very sick patients. They couldn't sign consent for study. And upon getting the consent, for those who consented, actually most next of kin of the patients are consented for the study. So these patients at the point of admission, that is in the casualty department, we drew some samples, blood samples, to analyze the electrolytes. So at admission, and then 48 hours after admission, we also took some samples to see whether there are any abnormalities that may have or may develop in a delayed fashion, so later on, and whether the initial abnormalities that were picked at admission corrected in 48 hours. So that's what we were really interested in. And we used methods that were under the supervision of a clinical chemist. So one of my supervisors is a professor in clinical chemistry, and we developed validated. We used validated tools and equipment to do the measurement of the ions, and that included both the internal and external quality controls, so that whatever values that we were getting for these ions were the correct ones. Yeah. So on the other part that was also very important to us was now the clinical parameters for the patient. like how they are responding, the Glasgow Coma score that I talked about. We also looked at blood pressure. We also looked at the interventions that were being carried out to see whether these interventions were contributing to these electrolyte abnormalities, because patients with severe traumatic brain injury, there are some medicines that are given to improve the condition. Yeah, so we wanted to see whether that has also an impact. And then we also wanted to see whether the radiological parameters also have a role in these electrolyte abnormalities. So these patients, apart from taking the samples for the electrolytes, we also looked at their radiological imaging, and in this case the CT scan of the head, to see whether they had any lesions or any problems within the brain, and we analyzed now all those.
Okay, look to have been a very comprehensive methodology that you implemented, and so I'm sure everyone is waiting for the moment where you share the results and tell us exactly what you found from your study and from the various things that you implemented and parameters you looked at. So what did you find?
Yeah, so with regards to this paper on potassium, there's the normal reference range for potassium. So a patient can be within the normal or can be below the normal range, that is called hypokalemia, or you can have above the normal range, that is called hyperkalemia. And remember I told you this potassium is very key for conduction of electrical signals. And when you look at the reference range, it's usually a narrow reference range. So one of the surprising findings was that most of our patients had hypokalemia. So there were quite a number, around 25% of patients with severe traumatic brain injury had hypokalemia, so low potassium, and then we got like 6% with hyperkalemia. So having now, and we also looked at now the effect of having this, both extremes, hyper and hypokalemia, on outcomes, on survival. And actually both extremes were associated with poor outcomes. Yeah, so that was one of the key findings that we revealed from the study. And we made recommendations based on our findings on early recognition of these electoral abnormalities and correction, because when a patient has hypokalemia, you can quickly correct that. And that is very key because, as I said, potassium is very key for conduction of electrical signals. And these electrical signals are going to muscles, to other organs. And for example, when you look at the respiratory muscles, you need to have you need to have normal levels of potassium for effective movement of the muscle. So one of the things that would happen is you find a patient with hypokalemia, they are not being able to be weaned off the ventilator because their muscle function is not very good. The diaphragm is not very optimal. So these are some of the recommendations we made, that we need to aggressively look for these abnormalities and intervene as quickly as possible. Because if we don't intervene, then we are likely to have very bad outcomes. The thing is, when patients have head injury, people tend to concentrate on the head, so on the brain, the injury. But then there are other things that are happening. We call them secondary injuries. And when we don't address these injuries or these secondary effects of the head injury, then we are likely to have a bad outcome, despite maybe very good surgery. Yeah.
Okay, that's very, very insightful, even for myself as an upcoming clinician. Mm-hmm. Yeah. So I think you've already given the recommendations that you'd have, but maybe just not to reemphasize, maybe you could give for any person who's listening and is a clinician, they're a doctor, or a physician, and they work in an emergency department, and they see such patients on a day-to-day. And so you can give them maybe just a takeaway for how this study can be integrated into their thought process in their day-to-day practice. And also maybe perhaps a word for someone out there who's listening. They don't really have any interest in medicine, but they maybe don't want to become a participant in the study. So yeah, maybe you can give them a word.
Yeah, so to the clinicians, the brain controls many things. It controls respiration, it controls the function of the heart. It also has some endocrine control. And when we get any injury to the brain, some of these functions may be affected. And the other thing is that the brain requires optimal functioning of the body for it to also give you optimal results. Therefore, for patients who have injuries to the brain, like now trauma to the brain, some of these functions may be affected. And one of these important functions is electrolytes. So electrolytes may be abnormal because of the brain injury, or because of the general injury to the body, or reaction to the injury. So some of these electrolyte abnormalities will be as a result of a reaction of the body to the injury. So for example, when you have a muscle injury or tissue injury, that can lead to release of quite a lot of electrolytes like potassium can be released, and that can go up. And sometimes when you have injuries, then we have some hormones being produced like adrenaline, noradrenaline, and all this can cause shift in the electrolytes. So for example, like we postulated in our case that with a severe injury, then we have shift of potassium from outside the cell into the cell, maybe because of production of these hormones like noradrenaline, leading to hypokalemia. So as clinicians, we should always be thinking of the secondary injuries or the secondary effects of the brain of brain injury, because these are very key to the outcome of these patients. Yeah. So anyone working outside there, don't just do a CT scan of the head. Think of the other injuries, and one of these things you think about is electrolyte. Ask for tests to look at the electrolytes for the patient, and then once you get these abnormalities, correct them as soon as possible. And even if you don't get an abnormality at admission, please conduct tests later on, because we saw quite a number of these abnormalities arose later on, so they came in a delayed manner. So always repeat the tests, maybe after 48 hours, 72 hours, and do appropriate corrective measures.
Okay. And for anyone who's just a lay person, not really in the medical field, does this study have any relevance for them?
Yes. This study is very key because it led to recommendations that are very key in improving brain outcome. Because when someone gets traumatic brain injury, many things happen. First, it's expensive to manage these conditions, and we see like in our society, we'll have to do a lot of this pooling of resources, doing RMBs, and this can really drain the society. The other thing is that that person may not have very good outcomes, so they may not go back to their usual activities like daily activities, like job activities. You see, now that is lost income. So someone will not be able to maybe take care of their family and such. So for lay people, we really need to be aware of these studies, and even amplify the results, so that we can have policies made, for example, to try and reduce these these accidents, road traffic accidents, because most of these patients came as a result of road traffic accidents. So we need to amplify this and this message so that we can have the government listening to us as clinicians, also policymakers can listen to us, and even the industry at large. Yes.
Okay. You've had it right from the author, and we thank you very much for a very insightful episode. And maybe as we come to the end, maybe if you have any acknowledgements, I know the paper was by Mwachaka et al. Maybe you can mention who the et al are and acknowledge their role, and then we'll have a parting shot.
Yeah, so this was a study that was conducted under the supervision of my very esteemed teachers, being led by Professor Nimrod Mang'ombe, who is a neurosurgeon, and at that time was the head of unit for Kenyatta National, for the University of Nairobi neurosurgery unit. And then also we had Professor Angela Amayo, who is a pathologist and clinical chemist, and also Dr. Peter Kitungu, who is a neurosurgeon and one of my mentors. I would also like to thank all the research assistants who assisted with the data collection and just the day-to-day running of the research. And then I would like to thank the patients, because they made us have this study done, and also the results that we were able to communicate, and also the caregivers who gave us consent to conduct this research. Thank you.
Thank you very much, Dr. Mwachaka. So there we have it. This brings our first ever author interview to a close. We'd like to thank our guest author, Mwachaka, and of course the et al. Who have been represented very well by Dr. Mwachaka. And to you who stayed and watched up until this point, we hope you've learned something. We hope you've taken something home, especially if you're a clinician. Remember, there is more that can affect the outcomes of your patients beyond the primary injury in the brain. Also be on the lookout for other secondary factors that may contribute to your outcomes, such as electrolytes, as highlighted by this study. We'd like to thank in a very special way our partners, Daktari Online, who've hosted us and offered the technicalities to be able to produce this episode. Thank you. Stay tuned. Remember to share, subscribe, and see you in the next episode.